Massage therapists know better than anyone the healing benefits of bodywork are not just for a lucky few. Rather, massage is for every body. ABMP's Massage is for Everybody Week, celebrated July 19th through 25th, is part of a bigger year-long movement grounded in advocacy, awareness, and inclusion. Join ABMP in celebrating the powerful benefits of massage and the meaningful role you play in your community. Together, we're helping to expand access, support underserved populations, and elevate the profession with compassion and professionalism. Learn more at abmp.com/massage-week. At Heights Retreats, massage therapists build stable and meaningful careers rooted in wellness and care. A place where therapists are dedicated to delivering exceptional care to the guests, not to filling their schedule. Heights Retreats care deeply about their therapists, our profession, and wellness itself. Grow with Heights as they evolve into a wellness-driven future. Visit heightswellnessretreat.com for more information.
Dear listeners, over the years of bringing you this podcast, I have noticed that some topics seem to cycle around on a pretty regular basis. Today's I Have a Client Whose story is part of that cycle, involving the interface between topically applied medications and the risks to massage therapists. I got a letter from a contributor, and here's how it goes. Dear Ruth, I have many clients using hormone therapy topically, like a gel or cream or patch. And I'm wondering, since this is absorbed through the skin for them, is this an area I should avoid working with directly during the session? I prefer to keep my hormones where they are so they can fluctuate on their own time. If this is an area to avoid, should it be just for the day that they applied the topical agent, or do I need to wait longer? Any thoughts are appreciated. It seems that there's been a surge in folks using HRT, and I don't remember learning anything about how this impacts massage therapists when I was in school 12 years ago. Thank you. Well, this is a great question. And I'm sure lots of massage therapists have the same thoughts and worries, and I am very, very happy to revisit this. I will also point out that I wrote a really good, if I say so myself, article for Massage and Bodywork on the topic of fentanyl pain patches a couple of years ago, and I will list that in the resources in our show notes because some of that is relevant. But this question is a little bit different because this contributor is not asking about patches. Patches are especially designed to keep the medication within the adhesive boundary so that the risk of leakage and accidental exposure is as low as they can make it. But if your client uses testosterone gel on their arm or estradiol cream on their thigh and it doesn't come up in your pre-session interview, well, where does that leave you? I did a little digging to see what we might have learned since the last time I undertook this, and I discovered a few very interesting details. Firstly, the most common hormones that are prescribed as topical applications besides birth control patches and vaginal estrogen, which are not part of this discussion. The most common hormones prescribed as topical applications are varieties of estrogen, progesterone, and testosterone. Let's talk about estrogen and progesterone first. Instead of going into a whole long background story on perimenopause and shifting hormones, which is a topic for another time, let's start here. Many people who are in perimenopause supplement these hormones. Let's remember also that estrogen is more than one thing. It's at least 3 different things. And which ones they use and in what combinations depends on a lot of things, especially around the risk of uterine or breast cancer. Topical HRT, hormone replacement therapy, has some benefits over oral medication because it bypasses the liver and the meds go straight into the bloodstream. This can make it easier to use for some people, especially if they have any history of liver problems. And statistically, we do see a lower risk of blood clots with this kind of application compared to oral medications, and that's an important piece of information. These topical applications are likely to come in the form of a gel or a cream or an emulsion or a spray. Patients are instructed to apply them to an area with thin skin and low friction. So upper thighs, lower abdomen, inner arm, these are frequent choices. Generally speaking, the medication with some form of estrogen and progesterone tends to dry within a few minutes, but patients are told to avoid skin-to-skin contact with any other people in that area for at least an hour. At that point, the risk of incidental transference with enough contact to create symptoms is extremely low. That said, low is not zero, especially in the form of estradiol emulsions, and we'll come back to that shortly. Now let's talk about testosterone applications. Again, these can come in the form of gels, sprays, and creams. They're usually applied in areas with thin skin and little friction, so thighs, belly, arms, sometimes the upper back. But the risk for cross-exposure with testosterone applications is much higher, mainly because the doses tend to be higher. Plus, testosterone is often applied in the form of a gel. This takes longer to dry and to be fully absorbed. Adult partners of people using topical testosterone can have their serum testosterone level rise by over 100% over their baseline numbers. And they might develop symptoms that include things like increased body hair and loss of scalp hair and acne. The medical records also show many, many cases of children being exposed in this way and developing acne, pubic hair, and other secondary sexual characteristics, even starting from age 2. I even found an article about adverse events affecting people's pets because of exposure to topical testosterone. So here's where we land. Topically applied hormone therapy is the best choice for some people. Some topical applications show a substantial risk of transfer to others, but this happens mostly in the setting of intimate contact for prolonged periods. Massage therapists absolutely 100% have the right to not be inadvertently dosed by their clients' hormone medication. So let's take those points and take another look at what our contributor just sent. Hi, Ruth. I have many clients using hormone therapy topically, like gel, cream, or patch. I'm wondering, since this is absorbed through the skin for them, if this is an area I should avoid working directly with during the session. Yes. I prefer to keep my hormones where they are so they can fluctuate on their own time. Also, yes. If this is an area to avoid, should it be just for the day that they applied the topical agent, or do I need to wait for longer? Probably not. Any thoughts are appreciated. It seems there has been a surge of folks using HRT, and I don't remember learning anything about how this impacts massage therapists when I was in school 12 years ago. Thank you. So this massage therapist is describing clients using HRT, and that implies some combination of estrogen, estradiol, progesterone. The data I have seen on this suggests that these applications tend to be in low doses over prolonged periods of time. They don't stay active on the skin for more than an hour after application, but the data also show that the partners of patients using estradiol emulsions found that their serum estradiol increased by up to 25% over their baseline. This is way lower than we were talking about with testosterone, but it's not nothing. Furthermore, it's quite possible that when we ask our clients about their medications, they might not include their new use or continued use of these creams or sprays or gels. It may simply not occur to them that this is important information to share with us because it doesn't seem like medicine. So here are my suggestions. First, make sure you ask this question on your intake form and include it in your follow-up interviews, especially for clients who are most likely to use these medications, which is to say, perimenopausal women or men with low testosterone. Second, find out where they applied it and when. And if it happened within the day, either skip that area or massage it through a barrier. Use gloves or the sheet. And thirdly, ask the client if they're happy with their treatment and congratulate them for taking good care of themselves. If this topic is interesting to you, I encourage you to check out the show notes. I found a boatload of really fascinating articles that I've provided links to, and you might find some of these interesting and useful. In closing, I want to give thanks to our contributor for asking a question I know that a lot of people have. And I want to give thanks for you for giving me a chance to re-explore a topic I haven't looked at in a while. And also, don't forget to send me your I Have a Client Who story so more people can benefit from all of our experience and curiosity. Thank you.
Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.